Hello, my name is Dr. Tony Hundle. I'm a consultant anaesthetist and pain specialist, and I would like to talk to you today about your anaesthetic for shoulder surgery. There are many different ways of performing anaesthesia for shoulder surgery, and this very much depends on the needs of the surgeon, your individual requirements, and the ability of the anaesthetist. For a general anaesthetic, you will be advised to have a preoperative assessment during which a general history and examination may be conducted and some preoperative tests can be performed. It is at this stage that it would be useful for you to let the staff know about any pre-existing medical conditions you have, particularly diabetes, warfarin, or any blood thinning medication that you may be taking. Regardless of the choice of anaesthetic, it is always advisable to have nothing to eat or drink 6 hours before surgery. If you fail to comply with this, then it may lead to delays in your surgery or even postponement on the day. The vast majority of patients have a general anaesthetic for their shoulder surgery. This involves a visit by the anaesthetist beforehand to talk to you briefly about your needs and your medical conditions and to discuss various options. Once the options have been discussed, a choice is made of your anaesthetic and you will be transferred to the anaesthetic room for your surgery. During this stage, an airway device is inserted into your mouth to protect your airway once you are asleep. Plenty of local anaesthetic is used in and around the shoulder joint to aid with postoperative pain control. Once transferred into the operating room, you are usually positioned either on your side or sat up in a chair position with head supports and knee supports to take the strain off your back. Calf compressors will be used to massage your legs, and a warming blanket is provided to keep you warm during the operation. At the end of the procedure, more local anaesthetic is inserted around the shoulder joint, together with regular painkillers, antibiotics, and anti-inflammatory drugs, so that when you wake up, the shoulder is nice and comfortable. Once you are awake, you will be transferred to the recovery room for approximately half an hour until you are more awake, warmed up, and pain controlled. At this stage, you will then be transferred to the ward for a further 2 to 3 hours before being discharged home for day case surgery. For some surgeries, you may be required to stay in overnight. Very rarely, some patients may be unsuitable for general anaesthesia, and in these particular cases, awake surgery may be an option. On occasion, some patients may even choose to have awake surgery, but this is a very rare occurrence. For awake surgery, an interscalene block will be administered using an ultrasound machine. Once the local anaesthetic has been placed around the nerves, a delay of 35 to 45 minutes occurs before the anaesthetic takes effect. The anaesthetic will be tested before surgery is commenced. Occasionally, a sedative is given to help patients relax. The advantages of this technique are it does not involve a general anaesthetic, but the disadvantages are that it takes considerably longer to perform the anaesthetic, which is technically more challenging, and it can lead to difficulties with blood pressure control during the operation, and that itself can lead to delays and slowing down of the surgical procedure. Some patients may need an interscalene block for their surgery. This will depend on the patient, the nature of the surgery, and the choice with the anaesthetist's involvement. An interscalene block involves an ultrasound scan being taken of the side of the neck and a small amount of local anaesthetic being administered. Depending on the choice of drug and the volume, this will determine how long the local anaesthetic lasts. A interscalene block can usually last between 6 and 24 hours. Most interscalene blocks are performed with the patient awake, but some are performed with the patient asleep, depending on the patient and the anaesthetist requirements. The interscalene block provides excellent pain control. It usually involves the arm being immobilized and the patient being unable to move their arm for up to 24 hours. The benefits of an interscalene block are excellent pain control. The disadvantages of an interscalene block are the unusual sensation of being unable to move your arm. There are very few complications with interscalene blocks, but these will be discussed with you on a case-by-case basis. I'd like to mention postoperative pain control. All our patients will receive regular analgesia during the operation together with local anesthetic or nerve blocks. After surgery, it is very important that you take the analgesia as prescribed by the anaesthetist. We usually use a combination of 3 drugs using paracetamol, codeine, and an anti-inflammatory. The most important aspect to remember, though, is to take your medication regularly. If the 3 painkillers are not enough, then additional analgesia can be used in the form of tramadol. Failing this, if that is still insufficient, then further analgesia can be prescribed by your GP in the form of morphine.